All right, so hello everybody and welcome. I'm Morgyn Danae of Morgyn Danae Wellness, and I have my wonderful guest here, Dr. Anita Wang of Laguna Beach. And your practice is wellness, longevity, and aesthetics.
Yes.
Um, Lovely. And I would really love it if you would tell us more about your practice. I think that that is the most wonderful way for everybody to kind of get more of a sense, more than me talking about it. I know that, of course, your background is an ER physician, and you have made a big shift to work in preventative medicine and in preventative aesthetics. But if you could say more about that, that would be wonderful.
So, I think the easiest way for me to explain what I'm doing now um, is just that it's in the title of my business, wellness,
Mhm.
and so
Mhm.
wellness is such a dispersed meaning to people. But what it means to me is um, how your cells are. I love biochemistry. So I do functional medicine, but it's about biochemistry. And it's seeing how your genetics, how your cells, and how your lifestyle all blend together and how they come out and put an effect on your body. And so your lifestyle affects your cells and your genetics makes an effect. So, if I have somebody with a genetic mutation, I'm not going to correct the mutation, but I can get their body to be as optimal and their cells working as optimal as that body is able to. And that's
Mhm.
what we want. So that's wellness to me, is
Yes.
optimal vitality and being well. And
Mhm.
then and then I have many tools in my tool basket to do that. So I can use Chinese medicine, I can use Ayurvedic medicine, I can use supplements. I do many different things,
Mhm.
and even structural. So like things that you do, dance also helps, and so getting the body in balance. So it's all about balance and getting it. So that's what encompassed wellness to me, and diving deep down and finding what your root cause is, and then
Yes.
longevity is because I hear people who are in their 40s, which to me, I think, depending on where you are on that continuum, maybe young or maybe old. And when somebody says, "Oh, I don't want to live," I'm already done. I'm 40. That's it. I'm thinking, no, there's so much more life, and that person doesn't have the vitality. So longevity. So everyone has an expiration date. And that is set by your genetics, by your lifestyle. And we have epigenetics in the last 20 years.
Mhm.
We can flip genes on and off, and we can either turn the cancer gene on or turn the cancer gene off or not turn it on. But you want vitality. So
Mhm. Yes.
so it's got to be the activities of daily living. So you want no disease and you want to have full capacity and vitality. So that's the longevity of it. So
Mhm.
science says we could live up to 200 years. Nobody wants to live 200 years as a vegetable or in a wheelchair
Right.
or in a bed or not thinking or not knowing, right? So it has to be full capacity, longevity, full of vitality, doing everything. And then typically what happens is once people are healthy from the inside, they start looking on the outside and they're like, well, I feel like I'm 20, but I'm, you know, XYZ. I want to look as young as I feel. So that's
Yeah.
where the aesthetics comes in because, I can't stop aging, but I can retard it, slow it down, and improve it. So
Mhm.
that's kind of what sums it up is the program I have is to keep your core, which is part of what you do, keep
Mhm.
it intact and keep it strong. And so that you can walk upright when you get down, you have to be able to maintain that posture, the strength and muscle and the ability, and to enjoy it till as far as you can go.
Yes. Absolutely. That quality of life and being connected to our healing process. Yes. And that's so wonderful. Again, and that's, of course, big reason why I have you here and want to hear from you and want people to know about you. Because here you are, really, I mean, you tell me, I don't want to put words in your mouth, but I consider you to be a holistic physician
Oh yeah, I think
that
I
way.
think so because um, we've talked many times because we deal a lot with women's pelvic health and things like that. And you deal with trauma with them and trying to recover them from just emotional, physical, and people having surgery on their pelvic. Maybe it wasn't necessary, maybe it's necessary, but but I would always try to hope to not disrupt this machine. So as this body can just, it wants to repair itself. So if we
Yes.
can give it all the things that it needs to help repair the self and what the issues, if it's not doing things right, that's a symptomology of something deep down. There's a root cause. Why is that not working well? And we want it to work as optimal as possible. And so it's much different than a quick fix, a pill. So I put on two different hats. When I work in the ER,
Hmm.
it's a reactive medicine. So it's like firemen who are waiting for the fire to start, and then they react and they put out the fire and they take care of it, and they manage it, and they can do it quickly, they can patch things up. And so some people just want to wait for that disease and get the pill and get the patch and get the surgery and get it all done, and then they're often good. But to me, the body is not whole anymore, right? It's not. So then there's things that we have to do. Or you could be the fireman that's standing around and they're telling you, oh, this is a fire hazard. We need to clear the brush. We need to get rid of this paper. We need to get rid of the clutter. We need to make sure the electrical wires are good, checking the infrastructure, making sure things are right. So that's preventative medicine. So that's the other hat that I wear. That's
Yes.
180 degrees opposite of the ER. So I get to do both
Hmm.
passionately. I like
Hmm.
to, you know, help people and save their life when they're in a true emergency. And I like to help prevent people from ever becoming their worst and ever becoming or getting into the emergency. And so that's the preventative side. But you have to be more willing to put the effort in versus having a quick fix.
Yes. Absolutely. Yes. And that is a partnership as well, and people learning the tools and applying it to their lives, right? That's the power in it as well. Yeah. Yeah, such a powerful approach, and we're on the same, definitely on the same wavelength with that. It's so much about empowerment as well, right? And us taking responsibility for our health and being supported in that. And so, today too, I wanted to, and this, this may be several conversations as well because it is such a big subject, but the subject of post-surgical recovery, holistic even post-surgical recovery for abdominal and pelvic surgeries, even years later. Um, it is a big subject. There are many different surgeries, but there are also some really big commonalities. And I have definitely seen over many years, 25 or more years, working with women and focusing in on the belly, on the pelvis, and healing, and in body work and fitness and dance as a healing art, and all of these areas, and mind, body, spirit integration and trauma recovery, all of it. Um, there's a big story here, and a lot of women are undergoing these surgeries or facing them, or it's very common, and yet recovery is so very lacking. Knowledge, information, support, awareness that it exists, all of these different things. There's a lot of gaps, and I really, really want to bridge with the medical community, those who are open and doing this, have this mindset and this approach and this heart for supporting people in general, but women especially in this case, to heal. I would love to just open up that conversation, um, and listen, converse with you, but also listen. Really want to hear your perspective on these things and your experience with them and what you've heard. So, in this case, we're talking, there are more surgeries and anything that you have to say about it. But again, this is the beginning of the conversation. This time that we're coming together, I'm hopefully many more conversations. But things like C-section, which is birth first, of course, but also these are major surgeries: tummy tuck, hysterectomy, hip replacement, and other abdominal pelvic surgeries. So I guess I'll just start out with a question, but I also will see how this rolls. Um, what have you seen in this case, in this general realm around recovery or information, women coming to you What is your general perspective on this area?
So I think that this culture is very unique because it's fat. It's very technological. It's cutting edge technology. Um, it's innovative. It's rapid pace.
Yes.
So when you do that, you forget to slow down and you forget about the basics.
Mm-hmm.
And the basics is number one, the body wants to be healthy and the body needs the proper fuel.
Mm-hmm.
So diet, nutrition, sleep, exercise, mood, um, slowing down, all of these things are not really thought of. We're in a quick hurry. You have, you have, you get a diagnostic procedure. You find out you need a new heart, or you need a new valve, or you need to have a hysterectomy, or you need to have a C-section emergently. You don't have time to prepare. And then they put you back up and then they say, you're out in 5 days and you're good to go. But that's not how the body works. So, and here it was, you deliver your baby, you're back in the fields, you're doing the fields right away. In my culture, you take a month off, you get nurtured, you have take the body has time, get the nutrients, make sure you get the proper nutrients for the breast milk to come. You get the proper nutrients to body to be repaired. And it's always ironic to me because women are so happy when they have this living being growing in them. And they just feel like they're so happy they're developing. But this living being is sucking the life out of them. It takes out the bone marrow. It makes your bone dry and hollow, taking all the nutrients from you. Your organs aren't working as well. And then after that, then you've got this baby that you've got to nurse, and you've got to get and you don't sleep. So how is this body recovering? So in this culture of fast-paced technology, we need to remember and need to slow down and repair. So the biggest thing is just take a deep breath, repair, know that the body does it, but it needs the right things. So you need anti-inflammatory foods, whole foods, real foods, not processed, not fast food, not in a package. And you want to just eat well, because food is either poison or medicine, depending on what you need and what's going on. Right? Yes. So to me, the recovery phase, people are not speaking enough about, and they don't realize until after they've gone, they go, wow, I didn't know it would take that long, or I didn't know it was going to be that much, or what they needed, or it took me a long time to build back my strength. But it takes effort. So the main thing is make sure you get the right nutrients. And if you know your genetic makeup, for example, if you have a genetic makeup that you can't convert those colorful colors of beta carotene into the active form of vitamin A, then you might need to take the supplement of vitamin A. But you're not going to know that unless you do testing. So certain things like that. So knowing your genetic makeup, knowing what your cells need, knowing your lifestyle, knowing that you just had a baby, you had a C-section, and your favorite food is fast food. Well, there's going to be a change because your body needs a little bit more help than the fast food.
Yes,
right?
for sure. Always, but especially at that time, for sure. Yeah. And so two things with that. First of all, well, I have two questions for you with that. When you say could you tell us what your culture is, that your background is, and also just the impact of all of these surgeries, with how big that is?
Yeah, so I'm Chinese, and so I grew up, with Chinese medicine, going to the Chinese doctor. They look at your tongue, they check your pulse, they give you all these little herbs that you take, and there was always a conversation of, and I wish I had taken note and I had remembered all of the things that they'd say. I mean, everyone knows, oh, have some ginger for your nausea, or they would say eat like eat carrots for your eyes, but there'd be other things, or eat,
Mhm.
eat frogs for certain things. There was always like, this is
Yeah.
for this and this is for that. Oh,
Yeah.
you need, this food is warm food. This is cold food. Oh, you're made of fire. You're made of that. So it's just knowing these little things. So it
Yeah.
wasn't foreign to me, and it's somehow deep down in there. And I had always wanted to do formal training. So I did go to China and I went and studied Chinese medicine. Um, Probably not as proficient as some of my Western colleagues that have actually really are practicing it, because I was I'm formally trained as ER, so reactive medicine, and then doing functional medicine and learning it that way. So I do more functional medicine, and I add a little bit of the herbs and things like that I know. So
Yeah.
so that
Beautiful.
was my culture, just Chinese. I just remember my poor brother. They would send all these things over, and they would brew this stuff up, and it smelled horrible. And my brother would drink these things. He's like, I can't drink another one of these horrible smelling things. But so that
Right. Yeah, and yet so powerful, right? So,
yes.
yeah, yeah, I hear you. Yeah, beautiful. Yeah, so in this, yeah, it's just wonderful. All of the combination of all the influences, and it's such an important thing for people to, for this information to be getting out, that there is a healing process post surgery. There is a needed one, and everybody is an individual and they have their own process. But just for all the women, and I'm curious if you've heard this. Again, we're talking in general. This is a kind of a general thing. You highlighted C-section too, which is so important for the mamas out there. But just the stories women are that I've heard over the years of there just not being any follow-up support or information or acknowledgement of the impacts. So, and for anybody who just feels like, oh, this isn't for me, I'm fine, I did it, it's fine, that's great. But we really want to be there and support and acknowledge the women who are saying, I just don't, I don't feel right. I don't feel that, I need something. I know this, in a myriad of issues that can come up, and they're simply not being acknowledged, or even in many cases, I've heard women coming with concerns to their caregivers and literally being told, that's in your head, or there's nothing you can do, or that's just the way it is. Say numbness in the core with around scars, different issues. And so I wonder if you could speak to that a little bit, different concerns and issues that you've heard women speak of, and how you've addressed those as
Yeah,
well.
so I mean, when you disrupt the body, either with trauma or surgical, the body actually takes about a year to get back. Right?
Yes.
So,
Yes.
but what is interesting, because I actually had this orthopedist says it. So let's, for example, I'm just going to take this is unrelated to abdominal, but I'm just going to say if you have back injury, right? So you have a back injury and you have a herniation, and
Mm-hmm.
then you have a nerve that's sticking out, and the disc is herniated, and then you get treatment, and that the inflammation gets down, the nerve is not pinched anymore, you're no longer in pain. Let's say that took 3 months, all right? So in that 3 months, you feel better, and then you go back to doing everything that you're doing, and then you have a relapse or you have an issue. The point is that because you're still alive, we have not done an autopsy to see how do you actually heal, right? So
Mm-hmm.
all those surgeries, if you are living and you've made it and you've gone and they say in 3 months you're good to go, and then you've noticed that you're still having an issue or that's not quite right or anything, it's because we don't really know what goes on in the body on all the healing process and what's going on. And you're good to go after 3 months, but I say that, and we know the body takes probably a year to heal. So all of those
Mm-hmm.
things lay down, so you have time. So when that heals, you're going to get a lot of the first 3 months, you're going to get the matrix and the fibroblasts, and all of those are going to build up, and you'll see scars. So sometimes the scars for the first 3 months, they start to build up, they get red and raised. And then after the next 6 months, they start to flatten out. And then maybe the color fades and things happen. And then people think, the scar changed over a year's time. Some get keloids, some get flat, some get stronger, some get weaker. But all of that, if it's a deep cut all the way, that's happening all the way down the layers, right? So
Yes.
there's
Yes.
there's all these things, adhesions, disruptions, so adhesions. So things that can happen is that you want to maybe prevent the adhesions, get the adhesions manipulated. Actually, my mother had surgery. She had a thoracic because they thought she had lung cancer. It turned out not to be. They opened her up, and then she had restrictions. She couldn't really put her arm around that much because she liked to swim, and she was trying to just do some exercises, and it was painful. So this, because the adhesions are there pulling, but
Yes.
she's one of those, we call them Nuchanan, like one of those really strong women. She's not wasn't going to let that affect her, so she's going to swim. So she's doing it, and then she's like forcing it, and she's like asking me, "Is that good?" I said, "Yeah, you want range of motion, forcing." And then she said she's
Mm-hmm.
hearing this ping ping. She's like ping ping ping. So, and all of a sudden she's free, and the pain is gone, because I think what she did, and again we don't know because she's alive. We didn't do an autopsy to take a look, but I'm sure that there was adhesions in there, and
Mm-hmm.
they were break, clamping things down. And when she broke the adhesions, it released things, and now she's got full range of motion, and
Mm-hmm.
she's doing well. So I think
Great.
if you have scar and you're protective and you're just slumped over, you're going to get adhesions, and people say this hurts and I can't stand it, and we need to break those up.
Yes.
So there's products, there's massage, there's things to do to help that, nutrition, because the body wants to be healthy, and
Yes.
you can try to help release those. um,
Yes.
Even visceral manipulation, massage, you do all of this therapy, so
Yeah,
this
I
really
do that work.
helps with that. And then
Yes.
nutritional support, and then just knowing your function. And then maybe you're somebody that makes more of these types of bands. Maybe you don't make these
Yeah.
bands, but again, if you're alive, we're not going to really know, unless you get genetic testing and things like that. So that's was the key for me, was saying that, yeah, we don't do autopsies on all the successful things that are healing, and so we don't really
To
know
find
what the
out.
process exactly is, right? And I like to deal in data and facts. So
Mm.
that's something, if we maybe took a little scope in, and to, sometimes they do studies like that, and they'll look, but I don't think there really have been any studies that monitor the healing process. It's pretty objective, like,
Mm-hmm.
how well are you doing, how well are you able to get back up to, what is your capacity, how much can you lift, things like this. So these are the things that we can monitor, but do we actually looking at the body itself? I don't know, I haven't researched that, but I don't think we are really cutting down and looking at the healing process. But it
Mm.
heals, so there's just a process that's happened.
Yeah. Yeah, but even, but even you as a physician, like acknowledging that process is very powerful. I'm telling you, like your voice is out there saying this because, again, that may not be the information that women are getting, or acknowledgement that they're getting, because um, even with those adhesions, how they can if there's no treatment or no self massage going on, no breath work, no, I mean, when I work with people hands on doing that work, but then I also teach them how to do it on themselves so they have a practice. But those adhesions can just continue to grow for years and years, cause respiratory issues, back issues, severe things sometimes, not trying to be high drama or anything, but just there's a range where it can just be basic numbness to digestive issues, so because those adhesions are connecting in everywhere. So literally, just that you're giving voice to this, that there is a need for healing, that there is a year process. It's not just like like a couple weeks, or go to a PT for like a 6 week process and then you're done. Well, you've got to keep going, and so it's bridging with holistic healers like me who are kind of, yes, I'm certified in these different areas and such, and have been doing my work for many, many years, but I'm still kind of outside of that system in a way of like the PT world. I have the corrective exercise, which is physical therapy blended with fitness, and then the body work element and all that. But it doesn't, there's the kind of the medical world and the physical therapy. It's kind of like in a way that intersects, but then it's also still all kind of separate. So being able to have voices, that we're bridging together in this way. So also women can get a sense that there's a continuum of care, right? Where so often they might come out of these situations and there's just no referral. There's no like information. Well, you can go to this person or maybe this. It's that there can be, and this is again a lot of what I've heard over the years. I'm not saying it's everybody's experience. Thank goodness it's not everybody. I want people to feel the continuum of care, but kind of this sense you had this powerful, intense experience that you don't even always know what to expect, and here you are, and then you kind of the feeling of dropping off the cliff, so to speak, like where is it, I don't know what to do now, and then of course sometimes when you're just googling things you don't really know what to do, so having like, okay, there's a bridge, you go along here, and so um I mean, that's awesome about your mother. Your mother's amazing, and I've seen your video with her too. But yeah. So just hearing that you bridge with women in these experiences.
Yes. Yeah. Yeah. People just have to know, just have to believe in the body and have the positive attitude, have the will and the spirit and know that, and you have to give it the right tools. So
Yeah.
nutrition, I can't, nutrition really took a back seat for many years in medicine. I think it's
Mm,
coming back around. And so that really makes a difference. And yeah, self-care, it helps. And
yeah.
so I think there's hopefully, I believe there's many physicians that are coming around to that and understanding that that's important, because I do get a lot of referrals from specialists that actually say, I mean, it's interesting, it's this off the subject, but like for an OBGYN, so you
Hmm.
would think OBGYNs know hormones, but they don't, because they give birth control pills, but they don't know, they're not trained in hormones. So I have them referring to me to 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 give hormones because I'm dealing more holistically and evaluating and doing that. And same, so I've had another, primary care physician who's not comfortable with it. And so I think that
That's
that,
excellent.
that
That's
I think that
so
is
good.
what I classify myself in conventional medicine is more, I am a subspecialist in, you know, health or wellness, because they'll say, eat less, go on a diet, lose weight, and then you're left to your devices. But I'm saying that you need personalized medicine and need to know cellularly, biochemistry, how you're functioning, to know exactly what kind of diet and how you want to eat and what kind of lifestyle fits for you. Whereas as a physician, conventionally, we're told, yeah, diet and lifestyle makes a difference. You go pick it and figure it out. But I'm actually that person who's going to help you sort it out
They
and
have the
figure out
next
which
step to
one,
go. Yeah.
right? And same with the healing process. They know that some of it's important, but they're not they're not into doing that part because it's fast paced and this is more personalized, right? So it's a different way of practicing medicine. So I'm really an extension of a subspecialty for them to help them because they don't have the time. They have to
Yeah.
see,
You can only do so much.
right? They only do, 15 minutes and they got to move on to the next person.
Yeah. But the fact that it's not just being, in your case, with the people that you're working with, and I definitely want to know more about them, they acknowledge they do what they do, but there's another step and there's somebody else that can be suggested instead of this is it, this is the end of the road, deal with, or there's nothing else that can be done. And, it's just like this kind of like
Yeah.
there's
Well,
nowhere
there
else
are
to go.
those who are,
The bridging.
unfortunately, in medicine, the average physician is practicing medicine is about 20 years behind. So epigenetics is only recently in the last 20 years or so. So depending on, not everyone, I mean, I'm not saying that they're not practicing good medicine or they're not keeping up, but generally that's just the average. And so I think that epigenetics is coming around where we really have a big influence on our DNA. And so we know that that is true. And so so definitely lifestyle makes a difference, and what you're
and
doing after
protocols.
surgery and what's happening. And so those physicians that say, oh, um, that's just the aging process, they're a little behind, because that was the dogma maybe 30, 40 years ago. I think that they need to, you know, learn more about epigenetics and realize that no, it's not. So, arthritis is not just part of aging. Dementia is not part of aging. Having, you know, decrease in strength and a weakness after surgery is not normal.
And
You know,
pain
having
during
pain, right?
intercourse,
All of
that
these
very
things.
intimate
Yeah,
blockages and such,
right. So those are
digestion.
not normal. So we need to fix those, and things that we can do for those things, right? So,
Yes.
but you know, it's not that they're bad. It's just that it's just um, the wisdom. I mean, I hear it every day. Conventional, it's a culture. Every day they say, "Oh, you're born, you're vital, and you're going to decline." And what I'm saying now is you're born, you're vital, and you're going to maintain. So we need that to
Yes.
be the mantra. And then after you have surgery, we want to build it back up to where you are at your optimal level. And if it's not healing the right way, we need to figure out what it is. I mean, unfortunately, there are times when they have to do surgery again, and they go in and they remove the adhesions. Maybe because if you have been trying to avoid them and you can't, and they bound you down, and sometimes you get blockage around your colon and your intestines, and you have to have adhesion lysis. But the ironic thing about that to me is that you have the surgery, now you have to go in and lyse those adhesions, and then later on, the adhesions from that surgery are going to come, and then you have to lyse those. So it does become repetitive. So if we can do something to prevent them, I don't know if there is things specifically to prevent that, because I haven't studied that or researched that. But maybe you know more about that. Are you able to prevent? But I do know once they have formed, there are some things that we can do to try to make them not as strong, or maybe break them up
Absolutely.
and things like that. But I
Yeah.
don't know about preventing them. I should probably research that.
Yeah, I mean, because I see the adhesion process or the scar tissue process is it's a healing, it's part of the healing process. It's just that it needs to be checked and supported so that the adhesions can be dissolved and the scar tissue can be dissolved and reintegrated back. And so things like, building your collagen, your vitamin C, seeing natural remedies, sea moss, bone broth, these kinds of things are really important for the health. Besides, in general, you're talking about
Right.
nutrition, all of these things, and movement, but in the right time. So you have your six
Mhm.
to 8 weeks. You get your clearance for your movement. But we need to move. We need movement is medicine, and it's how we do it. So we pace ourselves, and the hydration with water, clean water, all of and the rest, sleep. There's
Right.
a whole process, but um, yeah, it's a there is a rehabilitation recovery process, and then we're not even necessarily touching at this point because we're just getting things started, but the whole emotional process and all of these different things so that we have tools, and I personally see that when we've gone through these experiences, they could potentially be portals for deeper self knowledge, deeper healing, coming through, being even stronger. But when we have that mindset or that support, and the tools, we're being reminded of our healing capacity, just like what you're saying. It's such an empowering message, so that it isn't that you don't feel right, well, that's just how it is. No, there's so much more healing that's gonna happen. So Thank you. That's fantastic. Thank you so much for, just sharing your knowledge and your uplifting and empowering perspective. You know.
So thank you. Thanks for having me.
Yeah.
I appreciate it and helping. Like to just educate and help everyone to feel better.
Yeah, it's so important. Yeah, and you're so good at it too. So yeah, so I hope we'll continue to have these conversations, I know we will off camera for sure. Yeah.
Definitely.
So yeah. So thank you so much, Dr. Anita Wang, and keep doing your wonderful work.
Thank you. Thank you
Yeah.
so much. It was a pleasure, and
Yeah.
and you provide such great service for everyone, for the women out there. So,
Love
yeah,
it.
I'm glad to get the
Thank
message out.
you. Thank you.